Caleb, thank you for taking the time to come in and talk to us today about your treatment and how you're feeling. So I would start off just by asking you to tell us a little bit about some of the things you were experiencing symptom-wise before you came to Downtown Dental and started treatment.
So prior to my treatment, starting with Downtown Dental, it was very common for me to have recurring headaches a couple times a week, if not daily. I also have had a history of sleep apnea and a couple other medical conditions that have just kind of been present. And honestly, I just always thought that they were just quote unquote normal for me.
Yeah, fair enough. Since you've started treatment, what are some of the changes that you've noticed along the way?
Since I've started treatment at Downtown Dental, I think one of the immediate changes that I have experienced almost instantaneously was that the frequency of my headaches began to go away almost within that very first week.
That's great.
And not just the frequency of the headaches, the severity of the headaches. As I began to work through some of the myofunctional therapy and began to work through my treatment plan with Downtown Dental, I began to notice that even the musculature in my face was responding differently, and my sleep patterns were better. I was waking up well rested, or better rested, I should say, than what I had previously been experiencing. Again, I just had always thought this was a good night's worth of sleep, and this was just my body's way of reacting to stress was through headaches, and I slowly began to realize that really wasn't the case at all.
Yeah, sort of get entrenched in your own normal, and
when
you're there long enough, you can't get outside of it.
Well, you just don't. I don't think we realize what our bodies are really meant to do. And when all of a sudden you break that cycle, and I'm not having a headache every day or every other day, or I'm not, or I'm waking up well rested, and I'm waking up refreshed in a way that I can't tell you last time I was, and I can see. Just things in my sleep data and things that my wife tells me about how I'm sleeping, seem to be sleeping more restful. There's all sorts of things that are just early indicators of how my treatment plan with Downtown Dental is already impacting my life.
That's really encouraging. That's great to hear.
And one of the things I was so impressed with the team on the whole was that there was so much scientific research and there was so much data that they had their fingertips on and that they were considering. And it wasn't like, oh, we think this might work. There was a certain amount of conviction, whereas like, we know that this is an advanced procedures and we know that this can impact your life. And let's not just tell you about it or what could happen, but here's the research, here's the scans, here are all the data points that we can show you that where you can begin to track your growth. And as someone who is a very decisive person, someone who looks for a lot of that data to make decisions, it became very easy for me to go, you know what, these folks know what they're doing, and I'm going to trust a procedure, honestly, that I would have never in my adult life, I would have never previously considered it, because no one wants to go do adult orthodontics.
Sure.
But when I was presented with the facts, when I was presented with the data, when I was presented with a team of people that really truly knew what they were talking about and who were experts in this field, the decision became very clear. Like, yes, I'm going to do this.
Good. So the patient education part of it for you was very compelling. Kind of seeing how all the dots connected relative to the symptoms that you've been dealing with.
Yeah, the patient education portion was absolutely extraordinary. It was significant for me because as I was learning from the staff at Downtown Dental, I was going into my day in, day out life, and I was noticing things in the physiological makeup of people all around me that had been pointed out to me by the staff at Downtown Dental.
Yeah.
And kind of as I was learning and as I was exploring the options for me, I began to see things in other people, and all of a sudden light bulbs started going off. And I was like, okay, yes, I see it, it's here. And again, it very quickly pushed me down the road to where, yeah, I'm gonna jump in with both feet and go after this.
Good. That's great.
From a scheduling perspective, Downtown Dental has made early appointments available to me to where I can get in and get out before I even start my day. But beyond that, going into the myofunctional therapy practices, I drive a lot during the day, and a lot of the tools that they give me and the exercises that they have given me to work on my myofunctional therapy are things that I can do when I'm driving across town. It's super easy. And I've just adapted. Of course, everything that you do in life, it always requires something.
Sure.
If you can't get gain, you can't get benefit without having to do the hard work. And yeah, there is hard work. There is hard work around myofunctional therapy. There is hard work when you have orthodontics and you have to kind of relearn how to speak. But as someone who's speaking to people every single day in a professional setting, it's just work that I said, I got to do it. And I figured it out, and it wasn't hard. And I've been able to adapt. And I think that anybody who is ready to walk down this road with Downtown Dental will find the same thing I did, that it's not a insurmountable hill. It's not an impossible thing. Set your mind to do it and you can do it.
That's good. That's great to hear. Well, Caleb, thank you very much for coming in and spending we know you're a busy guy, coming in and spending some of your time with us today and telling us about your experience. We really appreciate it.
No problem.